Hi, it's Dr. Minkoff, LifeWorks Wellness Center. We have a therapy that we do here that isn't very common across the United States or even the world, and we call it PCUVBI. I won't unpack all the letters, but here's the basic idea. Ozone is a natural cancer killer, bacteria, fungus killer, and at the same time, ozone energizes healthy cells. So we typically treat people with ozone, and we take out some of their blood, we add the ozone to their blood, and we put their blood back in. Now, when you take the blood out, it can be done with a syringe or sometimes an IV, and it empties into an empty bag. And when the blood comes out, it's blood that has the oxygen taken out. It's venous blood. You know, if you take the blood coming right out of the heart or artery blood, it's bright red because it's gone through the lungs, it's gotten oxygenated, and it's bright red. But when you take blood from a vein, it's dark red because the oxygen is pretty much out of it. Now, if you take that blood out, add ozone, which is a form of oxygen. It's like 3 oxygens together, so it's like triple strength oxygen. And you add it to the blood turns bright red. It's beautiful, bright red. Now, if you take that blood then, and you run it through a machine where it's exposed to ultraviolet and 6 different wavelengths of light, you can get proteins in the blood activated, immune proteins in the blood that are activated, and your immune system beefs up and it gets stronger. So if you have cancer cells or Lyme disease or other stuff, your immune system now is like real strong. If we give people methylene blue, we use it commonly in the clinic. And you'll see patients sitting there hooked up to this IV pole. The bright red blood is now running through this machine. You can see the lights from the outside. It comes out the machine, it comes into your body, and as the blood is running through your veins, there are light banks that are on your wrists that then put several ultraviolet and red lights to expose the methylene blue that's in the blood, and it turns these things on. So it's energizing and it's killing at the same time. Now, there are some people who have developed, they look like wristwatches, but they're colored lights. My wife has one of these and she loves it. So she takes a dose of methylene blue and then she puts the wristband on and she'll walk around on it for a couple hours. She says, wow, it's energizing. And these aren't even drugs. These are like natural things. And what it's doing is it's allowing your body to use the oxygen that you breathe way better. It makes it way more efficient. And there's a little bit more detail to this that I can talk about. So inside every cell, there are little factories called mitochondria. And mitochondria take the oxygen that we breathe and the food that we eat and turn it into energy. Many of us have mitochondria that aren't functioning at 100%. So if you have fatigue or liver dysfunction, or you can't remember things, or you have heart failure, your mitochondria are not functioning right. That is the bottom line on what's wrong with all disease. The mitochondria aren't functioning, the body can't make energy. Bodies that can make energy are healthy and they're vibrant, but if they can't make energy, they're not. Now, in the mitochondria, there is this step 1, step 2, step 3, step 4, where the food gets the energy pulled off of it. And oxygen is required during that process. And what we find is that in people who have mitochondria that aren't functioning quite right, these 4 stations aren't working quite right. And what's so interesting about methylene blue is that if it's sitting there on the outside, it can pick the energy particle up here, move it all the way to the end. So if these aren't quite right, the methylene blue is like a bypass, and you get the energy anyway. That's why in so many people, they feel the positive effect from it because it makes all their cells work better. And then they have more energy, and then they can do better. And whatever they're trying to do, whatever performance they're trying to do, which is just live, it works better. The major defect in cancer is that these mitochondria don't work. So to some extent, when you add methylene blue, one effect is it attacks cancer cells. The other effect is that if you have malfunctioning mitochondria, that the methylene blue can get them functioning better. And you may bring cells back that would turn cancerous, and then they don't turn cancerous anymore. So PCUVBI is a great treatment. We deliver it here at the clinic, probably 20 times a day to different kinds of people. And it's available, and I wanted you to know about it. Okay? Hope this helps.